Bisa kencing nggak sih? Udah ya. Kalau mau normalin, ya normalin gini lagi. Dia ngedetek dulu, ngedetek apa tadi? Ini juga kiri ya. Kalau begini lama, jangan begini langsung. Ini kan udah gini. Kalau kucing juga nggak bisa. Kalau gini tuh nggak bisa dulu. Langsung begini. Kalau ngomong ini nggak salah ya. Nggak salah sih. Udah maksimal. Oh, kembali lagi. Ya. Ini nggak betul. Ya. Yang mau yang berapa? Ini enggak, ini enggak. Ini yang ini kan udah bagus. Yang ini dong. Ada kalau itu bakalan itu lagi. Kita udah bikin export lagi. Bakal jauh malah. Jauh lagi. Satu ya. Satu nih. Oh, berarti dimainin aja. Ini ngetek nih, ada tangan. Iya. Iya. Gini dulu apa? Warna kita. Lama-lama. Ya biru ke hijau. Biru ke hijau. Yang ini boleh aja. Di dulu di OBS.
Jangan. Itu aja udah nggak apa-apa. Kamu sini aja. Ini aku kelihatan. Ini aku kelihatan. Cukup kelihatan. Kan yang penting aku kelihatan sama. Ada 49.
Tolong bilangin kalau dari universitas lain, put your university.
Oh, oke. Nah, kalau misalkan itu aku bisa.
Gitu aja.
Ini apa Bu? Jadinya
Universitasnya karena banyak dari universitas lain.
Oke. University of
Ya, jadi kita tahu.
Iya, benar.
Partisipan atau
ini aku ngomongkan saja sekarang. Welcome to the online participants. I would like to ask you to rename your username. Please put your university of or institution name followed by your full name. Thank you very much. Once again, I would like to remind the online participant to rename your display name, put your institution name, followed by your full name. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Welcome all participants and distinguished speakers. Welcome to the International Seminar on Methodology and Publication. My name is Naila and I will be the Master of Ceremony for this seminar. There will be 4 topics to be discussed today, and the first session will consist of 3 topics. The first one is mixed method. The second one is community-based participatory research. The third one is getting your work published. And we will have another session after the break, and the topic will be ChatGPT for literature review. Before we start, let us rise to sing the national anthem Indonesia Raya, followed by Mars FKM UI. All guests, please rise.
Kartunya masih ada nggak, Bu? Sekali lagi ya. Kalau misalnya ke jalan, kapan Bu dapatnya?
You may now be seated. I would like to invite Professor Dr. Mondastri Kasudaryo, Master of Science, Doctor of Science, as the Dean of the Faculty of Public Health, Universitas Indonesia, to give the opening speech. To Professor Mondastri, the time and stage are yours.
Very good morning. Assalamualaikum warahmatullahi wabarakatuh. It's a really good opportunity that we can gather here together. Most welcome for all of you, particularly our guest professors, our distinguished professors, Professor Marjolin from Vrije Universiteit Amsterdam, Professor Subedi, also from National Institute of Health, Nepal, yes, and also there, Dr. I forgot her name. I'm sorry. Ruth, Dr. Ruth Peters, yes, and I suppose there's another one more colleagues from UV, Vrije Universiteit Amsterdam, and all colleagues and also beloved students that able to come together to this morning seminars. So it's really a great pleasure for us that we can gather here together to learn more from our expert, international expert. Hopefully this will be a opportunity, especially for all students to increase their knowledge, enhance their knowledge, and also get more insight and experience from the expert. As all we know that the title of the training or seminar today is yes, International Seminar on Methodology and Publication. So we'll learn together here with the guidance and also speech from the expert about some methods that we will be using, yeah, most frequently, such as mixed method, yeah, and CBPR. So I hope that you all can enjoy and get opportunity to also learn one to each other, because I suppose that in this occasion we are coming from different parts of study program. Yeah, I suppose there are study program of doctoral and also magister, so we can learn together. Hope this opportunity will give us opportunity to increase our knowledge and also our competence. Yeah. So not to further delay, we shall start this seminar very soon. So God bless all of us. Thank you very much. Good morning and assalamualaikum warahmatullahi wabarakatuh. Yes.
Thank you very much, Professor Monestri, for the opening remarks. And now we shall start this session. I would like to invite Dr. Rita Damayanti to explain the flow of the first session. To Dr. Rita, the time and stage are yours.
Thank you, Naila. Very good morning. Yeah, welcome everybody. Our special guest, from Free University and from Patan Health Science University, and also all of the participants, the PhD students, this year, so it's a 2023 for your first. It is very lucky that you have this international seminars, and then you'll get many experience from our lecturers, and also this is our PhD students, and we also have international students. So they are from Pakistan and also from Tanzania, So it is you can also hear, about the methodologies and then the publications, how to publish your manuscript, Okay, and the sessions will be 2 parts, One before the prayers, Friday prayers, Right now we have around 3 hours to discuss about 3 topics. First is about publications, and then 2 about methodologies, CBPR, and then mixed methods, the things that usually the PhD students use it in their study, and Ruth has a lot of experience in that kind of study, so okay, and also Professor Subedi will discuss about CBPR, right? Okay, and then Prof. Majuline, she has a lot of publications, so we should know the secrets. Okay, 3 hours will be led by Professor Majuline, and we need active discussions. That's why we already put your name there, so Prof. Majuline can see it. So feel free to raise your hands, and also for the online participant, you can also ask questions to us, So Naila will take care of it, Okay, so Prof. Majuline, times is yours. Thank you.
Thank you, Ibu Rita, for this very nice introduction for us. Can everyone hear us also online? Is that okay like this? Yeah? Okay. Great to see so many faces, and nice that you have your name tags on. Let's first start with an introduction of the 3 of us, your guests of today. To start with myself, I'm Marjolein Sweekhorst, and I'm Professor Innovation and Education in the Health and Life Sciences. I started once medical biology, so I think that's a little bit health related, like most of you probably also are. And after my PhD, after that, I did my PhD and I went to Bangladesh. And I did my PhD with Professor Yunus. I don't know where you remember him, but that's a long time ago. But once he was very famous. And I worked a lot with CBPR, community-based participatory research in that field. And for me, in a sense, it was also easy because this community was very new for me, coming from the Netherlands and then in Bangladesh. So I had to learn a lot. And when you realize you have to learn a lot, it's rather easy to use different methodologies. We'll also introduce that today to you. So for me, I really didn't know what questions to ask. So I started making drawings with these local communities to understand more about their environment and how they lived, because I really didn't know anything. So But these methods are not only in that, also if you think you know the culture, these kind of methods really help because most of the time these settings are so different you can't imagine. So it really helps to have a very open discussion. And in our case, we wanted to develop more technologies suited for the local communities. So starting with their knowledge, a lot of the technologies, at that time I worked in agriculture, didn't fit the local environment. We had, for example, these high seeds, quality high seeds, but they needed fertilizer, they needed irrigation, and the local community didn't have that, of course. So by involving their knowledge into science, we developed varieties that they liked. They liked this red potato, probably maybe you know that as well. They didn't like the white potato, but the red potato. But we developed together with them innovation technologies suited their environment and their needs and their interests. So that was very valuable. Now, after my PhD, I continued working, but I came back more to health again. So I did a lot of research in access to healthcare in various countries over the world. So I worked in the continent of Africa, in Tanzania, in South Africa quite a lot. But I still have a lot of PhDs there. So I like that I have them in Kenya, in Benin. So that's very interesting. But also in Asia, we still have a lot of PhDs, amongst others in your university, we have 2 students. And directors there, but we don't have the students here. But we also have them in other countries in Asia, India, and I liked it a lot to be around and to learn a lot from you as well. So also today, I hope to learn a lot from you as well. And then after my PhD, I became university lecturer and in the end a professor. And I have a major interest in methodologies, especially more the participatory methodology. So I really hope to share that with you today. But also on the other hand, how to train students in that. So in the Netherlands, I'm a program director of 2 master programs. One is medical biology, which I also studied. And the other one is a long name, management, policy analysis, entrepreneurship in the health and life sciences. But these are students coming from a health science background, and they want to do not only laboratory research, but also more in policy and management. So that's the other program. And there I think that's why I can practice also my other skills, how to train students in these competencies. Because now we will discuss with you later on, but it's not just go to the field and discuss with people. You need to have certain competencies and skills to make that work, to have the knowledge you would like to have and to integrate it with other knowledge. That's not straightforward. So we hope that at least, I don't think after these 3 hours you're really an expert in that, but we hope that we challenge you a little bit and discuss with you a little bit like the difficulties faced and how we can develop strategies, think of strategies together, how to deal with that. So that I'm still doing. So I do basically 2 types of research. First, methodology development, and the other one is training students in this kind of competency. So I feel really nice today because this is really one of the things I like most. And it's nice to have a different type of, different group of students today. And also for online, I really hope you participate. It's very good to see some faces. I see you are with 70 almost now. Now we see a few, but please interact with us today. Thanks for being here. That's basically in a nutshell who I am, and I hope to share some more of my experience throughout this morning. I will give the floor to Ruth, who will introduce herself.
So good morning. My name is Ruth Pieters. I'm an assistant professor at the Vrije Universiteit in Amsterdam. I have a Master of Science in Public Health Research. After that, I continued my education. I did a Master of Arts in Development Studies, bringing 2 scientific disciplines together, bringing 2 already, sort of methods from different disciplines together. After my master education, I started a PhD in a project which we call the SARI project, and I will tell a bit more about this during my presentation. But the SARI project took place in Cirebon district. Dan di sana saya juga belajar bahasa Indonesia. Tapi lama dan di Belanda saya tidak bisa praktek dan lupa kata-kata dan kata. So di sini saya I continue in English, but before it was quite good, but now I'm not that confident anymore in my Bahasa Indonesia for a presentation like this. So I will continue in English, but so my field work was done in Cirebon, and I stayed there for many months and years. Yeah, and I will tell you more about this later. So after my PhD, so in my PhD research, I focused on the disease leprosy, Kusta. But after my PhD, I worked on many different conditions, actually, HIV/AIDS, mental health conditions, albinism. And what these conditions have in common is that there is often a stigma attached to them, labels or stereotypes, discrimination. So that's one of the areas that I'm really interested about, passionate about, actually. Quite some of my work centers around this. I'm super excited to be here. I'm happy to share some of the lessons that I learned along the way. And I'm, as Professor Marjolein Zweekhorst already said, I'm also really keen to hear from you and learn from you during this seminar. Thank you.
Okay, thank you, Dr. Rutz, for this nice introduction. And we're looking forward to hear from you in a couple of minutes. I will give the floor to the next of our three persons, Dr. Sabedi. Could you please introduce yourself?
Yeah, thank you. Thank you very much. I'm Madhusudan Subedi. I'm from Nepal. I'm from Asia. So I currently teach Health Science University. We have 3 schools in Health Science University. This is the new university in Nepal, established in 2008 only. We have nursing and midwifery. We have School of Medicine and School of Public Health. Before that, I used to teach Tribhuvan University, which was the oldest university in Nepal, which has 400,000 students and more than 1,000 colleges in the country. Difficult to manage, I think so. So later on, I was invited in the new university, and currently I lead the Department of Community Health Sciences in the School of Medicine. At the same time, I also lead the School of Public Health there. I will tell more about my work later in my session. Thank you very much.
Thank you, Dr. Sabedi. And let me tell a little bit more about our university and adding to yours. Both Ruth and me are working at the Vrije Universiteit Amsterdam, VU University. That's also quite a large university and located in Amsterdam. In total, we have 30,000 students, divided about 11 faculties. The 2 biggest ones are economics and the science faculty. And in the science faculty, we have also this the health department. Next to that, we also have medicine. That's on top of it. But these are the biggest ones. And of the 2 science master programs, which are the largest, are exactly the ones I just mentioned, the biomedical sciences, and as we call it in abbreviation, the MPA. So it's in our case very popular to do research like us. And in our department, we both work at the Athena Institute. And the Athena Institute is really an institute that focuses on transdisciplinary research. And we do that in the health subject, but next to that, we do that in other areas like sustainability, like technology, areas where it's not one person knows the answer to where to go to. What is the best solution? If we can't define it, then transdisciplinary research involving different stakeholders becomes an important issue. And that's these issues we like as a department. And at our department, we have 120 colleagues working with us on these various subjects. And we have a quite diverse institute as well. I like that a lot. We have various disciplines on board for the same reason, of course, because every discipline has their own knowledge, but that's interesting, but it's not enough to address these complex issues. So we have colleagues from various disciplines as we have them from various locations all over the world. So it's a very diverse institute, I would say, and I love to work there. Okay, now let's go to the exciting program of today. We have 3 topics, what's already mentioned by Rita. And as a starting point, I really like to know, what do you, and raise your hand if you would like to respond. What is for you making that? Nice. Very good answer. So that's one way it could be. It could be qualitative and quantitative, and that's important. And it will show us later on more details about it and show examples, because different methodologies give different type of knowledge. Yeah? So different insights. Yeah?
Good. So it's community-based or recording in progress. Now, no, I see you're nodding. Maybe we turn around a little. You're going to be with for making it up. I think
Thank you, ma'am.
Yeah, thank you. Yeah, and the next topic, which will be discussed with Dr. Professor Sabedi, is then focusing on this qualitative research, and a particular type, the community-based participatory research. And that's really going into the field, discuss also with local communities, and that's part of the qualitative methods, I would say. So thank you for that.
Thank you.
And of course, if you do high quality, because the last topic is the publication. And as a scientist, as a PhD, that's of crucial importance for you to publish. I think in your programs, you need 1 or 2 publications, maybe more. And how to do that? And that's complex. So don't expect today the recipe book from us, because there is no recipe book. But what is crucial, if you would like to have a high quality publication, is to do high quality research. That's really the first step. So in that sense, the topics of today are very interesting, because having good quality research starts with good quality methods, of course. Good methods results in good data, and good data, after good analysis, of course, can result in high publication. So therefore, today, it's a nice flow, I think, we have for all these topics. Now, we really like to know, we spoke to talk all the people online, but it would have a good idea a little bit about who is on the table. So I would suggest we do a quick round. You just say the name we would like to you be announced, so the one that's just on your white plate, and tell us what methods do you use now for data collection, or you are planning to do if you just started, and if a little bit about just one research question, like my question is how to access to healthcare in Indonesia, just briefly. That is the topic of your research, and if it's not that clear, then now, make it short, And the research methods you're planning or you have conducted or planning to conduct. Yeah, is that question clear? Yeah, shall we start here? Isti, could you please tell us briefly your topic and the research methods you use? I will walk by with Mike. Oh, okay, just pass the mic, then it's easy, I think.
Okay, my research is about using mixed method. The first step is qualitative method. I'm planning to have a deep interview with the HIV survivors. And then for the second step is doing a quantitative method with the cross-sectional study.
Nice.
And I'm learning about stigma among them.
Oh,
Thank
wow.
you.
Nice.
So it's very, I'm so lucky that I can learn from Dr. Ruth that is also focusing about stigma. Thank you.
Nice. Thank you very much. Yes, please pass through. Nice. Thank you.
Okay, thank you very much. Good morning. My research using mixed method, exploratory sequential research method, and my first step is qualitative. I learned about how the socioculture about access of antenatal care of pregnant women and malaria in pregnant women.
Nice.
And then I using the result from qualitative method to make a strategy and doing a pilot project in the quantitative.
Thanks. Your
Okay,
name is
thank
Ayu,
you.
is that
Yes.
correct? Yeah, okay. Novi?
Okay, thank you. My research is about referral emergency obstetric in primary health care. My method using mixed method. In the first, I use qualitative method for in-depth interview for now to know factor influence with referral in primary health care. And then I quantitative for analysis with biostatistics.
Nice.
Thank you.
You.
Yeah, thank you. Actually, my plan is just a plan.
Very good.
It's about I would like to develop a kind of model for the cardiovascular disease, how to prevent and the initial handling in the workplace area, specifically in the energy company, in energy industry. So the plan to find out and answer my problem is a mixed method, a quantitative and qualitative with the research and development method. Research and development method.
Nice.
There is many steps that I have in my mind. The quantitative, I'll grab the initial data, find out the gap from the risk factor for the cardiovascular, what is the in theory and what is the in reality in our employee, and we find out the risk and would like to reduce the risk. It is have a 6 risks for the cardiovascular disease prevention, and also we would like to find out the current readiness of initial management in the workplace.
Okay.
So after we get the reality, so find the gap and then continue to the quality to asking in focus group discussion and maybe deep interview for the key informant and so on. So hopefully
Nice,
that's
thank
the process. Thank you.
Yeah, well, that sounds promising. Thank you. Vita.
Okay, thank you. My plan is some topic as like structural equation model factor for early marriage among girls in Indonesia, and another topic is development of reproductive health counseling system for teenager and prospective rates for teenager in school based on progressive web application.
Nice, interesting research topics you all have. Thank you, Vita.
Okay.
Dion.
Thank you. My name is Dian. For the research, I want to develop tools, readiness tools for breastfeeding, breastfeeding guideline tools for midwifery in antenatal care. Maybe I want to I want to using mixed method for this research to midwife in Bogor. Thank
Nice. Thank you very much, Irma.
My name is Irma. I would like to make a research about low birth weight babies and nutritional support. I want to explore about the support of the hospital for breastfeeding, especially for sick neonates and preterm babies. We can see from WHO recommendation that every hospital should apply the policy of baby-friendly hospital initiative for support sick babies and also preterm. So in the first time, I will collect data about the percentage of giving breast milk for sick and preterm neonates. And after that, I will develop a model for a hospital, how they can support, how they make a policy to support breastfeeding for mothers and also family center hospital. And I will use a mixed method that in the first time collect data from interview for the staff at the hospital, and then quantitative methods that measure the success of giving breast milk for sick neonates.
Nice, thank you very much. So interesting researches you all have.
Hello,
Anjit,
yeah.
is that how I
Anggit,
pronounce?
yes.
Yeah.
Nice to meet you, Professor Mechelen, Dr. Ruth, and Professor Savedi. My name is Anggit. Actually, I am not start beginning for research, but I have just topic of my research is about develop some indices, some index about micronutrient index, maybe, or hidden hunger index, maybe. It's maybe mixed method. First, start beginning from qualitative, maybe, for this study about it, and after that quantitative, maybe it's some like exploratory method, maybe some indices
Nice.
about micronutrients index. Thank you.
Thank you. Before we continue, I really interested and I'm impressed by all the research, and I really would like to talk to you individually a lot more about your own research. I hope we can share during the discussion, but I think it would be now nice to move first to Ruth, and after Ruth, we have some questions, and then we do another couple of PhDs because you are with so many here. I think we split it up a little bit, but it's good to hear that there's so many researches that are similar to the topics on the table right now. So I would suggest that you take the floor first. And for all of you, also online, because I think we have now 75 people online, but we have a whole team for you behind the computer, people online, to catch your questions. And we have a nice flow of system that the questions will reach me. So please, while sitting here listening to it, write it down. If you have very urgent questions, just start waving because we will interrupt. So if you really think, okay, I don't get it anymore, we need to stop because otherwise it's useless. So if you have a question, just don't hesitate to raise some of your hands and then we will stop. Otherwise, make notes, write them down because we really would like to have a discussion afterwards. Yeah. And then we continue with the PhD interest. Okay, thanks. The floor is yours.
Thank you, Professor Marjolein Zweekhorst. Okay, so I've prepared a short presentation about mixed methods, sharing my own experiences. I kept it short. I don't know how long I take. Sometimes it takes a bit longer, but I on purpose kept it a bit short, so we have a lot of time for questions, right? Because I didn't know the audience yet. Now I know a bit. But I think it's really nice to have time for questions so that I can really address where you are in your PhD research. I'm excited to hear that so many of you are planning to use mixed methods, and you're probably in the phase where you need to justify your choice. Why am I using mixed methods, right? In our case, we often use mixed methods because we focus on a complex problem and we use a transdisciplinary approach. And so that's why I will start this presentation with talking a bit more about transdisciplinarity and the justification for using mixed methods. Yeah? After that, I will share my experience from the science and if there is still time, I can share a short story about different research methods. Let's see. So first, a definition. Transdisciplinary research. What is this actually? Right. So Klein defines transdisciplinary research as follows. It's a new form of learning and problem solving involving the cooperation between different parts of society and science in order to meet complex challenges in society. Solutions are derived in collaboration with multiple stakeholders. Yeah.
The same, but offline we have some difficulties reading the slides. We probably have the connection problem. The way what we will do, I will ask Rut to slowly read what's out there on the screen, so we at least know, but we know that it is a problem and we are working on it. But we will at least first read out the slides, is my suggestion, and then Rut explains more, but read it slowly. People can understand what's on the slide. So briefly explain what's on the slide, that's my suggestion.
Yeah. So I just read out the definition actually that is on the slide. Shall I read it again? Yeah? Okay. So this is a definition of transdisciplinary research. Yeah, we have an echo. Transdisciplinary research is a new form of learning and problem solving involving cooperation between different parts of society and science in order to meet complex challenges of society. Transdisciplinary research starts from tangible real-world problems, and solutions are derived in collaboration with multiple stakeholders. Okay. So what this means, in health sciences, there are a lot of complex problems that are not easy to solve. For example, stigmatization, right? But many of the other topics as well, they're not easy to solve. And the idea is that we need not a single discipline, but a combination of scientific disciplines to understand the problem and to address the problem. But we don't only need science. There's also very valuable knowledge in society, in societal organizations, in health professionals working in a clinic, working in the hospital, patients. They have valuable knowledge that we need to understand before we can find the right solution. Yeah. So in transdisciplinary research, we bring this together. So let me talk. So monodisciplinarity, it's important, right? It's great when you have certain research questions, you need a monodisciplinary approach. But when we talk about complex problems, a monodisciplinary perspective would be very limiting. right? I have this very nice drawing. Oh, yeah. Can you go to the next slide? Thank you. Yeah. So this is a visualization of a monodisciplinary approach. Just one single discipline is helping. Can you go to the next slide? On this slide, you see an elephant. Yeah. And if we would all take a monodisciplinary approach to understand this elephant, we would all look at different aspects of the elephant. And the tail of the elephant might look like a rope, right? The leg of an elephant might look like a pillar. Yeah. But if we don't integrate, if we don't learn from each other, we don't get the full picture. Yeah. So there is a limitation in monodisciplinary research. So that's why we have other approaches at hand: multidisciplinary research or interdisciplinary research. Next slide. Yeah. Thank you. Do you want to? So multidisciplinary research. So this is when there is a topic. Different scientific disciplines contribute to understanding the problem, but they don't really work together, right? A metaphor that we sometimes use to explain this is when different scientific disciplines write a book. So maybe they write a book about breastfeeding. Yeah. Chapter 1 is written by public health researchers. Chapter 2 is written by social psychologists. Chapter 3 is written by dietists. But they don't communicate, all different chapters. They all bring a contribution, but they don't integrate their knowledge. Yeah? Interdisciplinary research, yeah. Again, different scientific disciplines that work together, but then they communicate. Yeah? They communicate, they work together, integrate their understandings. We also have transdisciplinary research when we involve the non-academic environment. We involve patients, nurses, anybody. Yeah, next slide. Thank you. At our department, at the Athena Institute, we are specialized in transdisciplinary research. And you can imagine when you bring different scientific disciplines together, they all have their own epistemology, they have their own theories, conceptual frameworks, and they bring their own methods. So if you start to work together, you often end up with a mixed method study. Yeah? So in our case, we want to understand and address complex problems. We believe that a transdisciplinary approach is a very new form of learning, a very interesting way to do science. Because of the different disciplines, mixed methods. We often end up with mixed methods projects. The SARI project was a mixed methods project. It was a transdisciplinary project. SARI, so this is an abbreviation, thank you. The abbreviation stands for Stigma, Assessment and Reduction of Impact. Stigma, Assessment and Reduction of Impact. And we focused on just one condition, leprosy. We did our research in Cirebon district, Indonesia, of course. The aim of the project was to reduce stigmatization. Yeah. Leprosy is a very, it's described as an old disease with a very severe stigma attached to it. And we really wanted to understand the situation and the lives of the people with leprosy better and improve their quality of life by reducing stigma. In this project, we co-created 3 different interventions. Co-created together with academics from different disciplines and patients, yeah, and other actors in the society. three interventions. So the first one was a counseling intervention. But because we work with patients, it's a peer counseling intervention given by other people affected by leprosy. People affected by leprosy were trained to offer counseling to other people affected by leprosy. We also had a more economic intervention, a socio-economic intervention. And the third one is a contact intervention. In the SARI project, there were 3 PhD candidates, and each of us focused on a different intervention. Dadu, who you might know, was my colleague in the SARI project. He focused on the socio-economic intervention. We also worked with Mimi Lusli. She's also an Indonesian citizen, and she focused on the counseling intervention. And I had the privilege to focus on the contact intervention. So what is the contact intervention? In the contact intervention, we try to challenge stereotypes. Challenge stereotypes. We all, also in this room, we might have stereotypes, we might have assumptions, we might have our own ideas about people with a mental health condition, people with leprosy, people with HIV/AIDS, right? And when we bring people into contact, when we meet people with these conditions, it changes our minds, it changes our thinking about them, right? Yesterday, we heard this very nice example of a DPO, a disabled people organization in Cirebon, who is challenging stereotypes. So they told us that, so these are people with disabilities, and often they told us they are perceived that they are the ones needing support, needing assistance. So what they did, they collected money together, they collected their things together, and instead of being this group of people that needs help, they offered their help to other groups. They offered their help to orphans, right? So challenging the idea that they are the ones that need support, but instead giving, showing we can actually give to others. So this is one way to challenge stereotypes. Not yesterday, but the day before, we heard another example about challenging stereotypes. So this is an example from Dr. Emeka from Nigeria. He joined a seminar on Wednesday. He told us the story where a doctor in the clinic, where there was a patient with epilepsy, they drank from the same cup. Right. Just to show epilepsy doesn't spread by drinking from the same cup. Making a very clear example, challenging stereotypes, yeah, can be very powerful. So this is what we also try to do in the contact intervention. We brought people with stigmatized conditions into contact in people without stigmatized conditions. Because when you meet a person with a mental health condition or with leprosy, you can actually go, they are actually very friendly. Oh, this person is actually very funny. Oh, wow, this person is brave, right? So there's something very powerful in meeting, instead of only the stories that we read in the newspaper or see in movies, right? We need to meet each other. Contact intervention. Next slide. So yeah, so this is in one of the offices, so we moved. So this was the first office in Cirebon in the Kota, where we had our office. Yeah, so this is a map to show that we organized these events where people meet in the community, in the different kecamatan and the desas in the Kabupaten. Next slide. Yeah, okay. So how to bring people into contact? We often do this through a testimony, right? We invite a patient to come and share their story. But when you think about interventions that need to be scalable and easy, not too expensive, right? You cannot always bring a patient, right? So what we did is we made a combination of tools. Sometimes there was a patient that shared a story, but we also used different methods to bring across our message. One thing is that young people affected by leprosy made comics, short stories about their lives. And we used these comics, it were their messages, and we used this to bring people into contact, right? We also made a video. We didn't make them. We learned people affected by leprosy to make a video. So they could decide how they would be represented. So they could decide what the message would be. So these are some pictures from the comic workshop. And next slide. This is some examples of pictures from the events. So we organized the events in the Kepala Desa, in the village hall, in schools, in the mosques, at people's homes. Sometimes there were only 5 people. Sometimes there were 600 people joining contact events. Okay, how to measure the effect of a contact intervention, right? So for this, we used mixed methods. We used a range of qualitative methods and a range of quantitative methods. Not only one. It was fortunate to have a big project, right? So we had interviews and focus group discussions before the intervention. We had interviews and focus group discussion after the intervention. And we used 5 different skills, quantitative tools. Some for people affected by leprosy, some for community members. As Professor Zwekor said, the quality of these methods is so important because that's, it's the foundation of your research. So that's why we also put a lot of effort in the development of these tools. Some of the skills, the WHO quality of life, we know, it has been tested, it has been validated. But there were some other skills that we, for example, it was a skill, the Burger skill. It was developed in the area of HIV/AIDS, but we had to adjust it to leprosy, but then we had to validate it. So there was this whole long validation process. So we were absolutely sure that the quality of the method was okay, the validity was okay, the psychometric properties were okay, so that our conclusions in the end would be valid. So a whole range of qualitative methods, a range of quantitative methods. So these are some of the quotes from the qualitative methods. One of the key informants, so the in-depth interview, IDI, it was very useful. As the village chief, I can share this information to the community. They should not be afraid of leprosy. They should not exclude the patient. It's what somebody told us, right? During a focus group discussion with family members, my husband is now very active. He's out of his hiding place, full of spirit, helping me to make and sell crackers. I'm really amazed that my husband wants to deal with many people without fear and worry. We also spoke to persons affected by leprosy. I became happier. I have more money. I can go to the market to sell something. I used to stay only at home and have no activity, right? Very powerful quotes, powerful stories, right? But we also know if we show this to policymakers to tell them, oh, this intervention is very effective, they will, they will say, oh, you just selected the nice quotes. We don't know, this is not representative. You have one key informant, one family member, one. So sometimes to convince policymakers, I think, not sometimes, I think to convince policymakers, we need mixed methods. Yeah, we need the story so that the impact comes to life, that we understand the type of impact, but we also need our quantitative results, right? So I told you we had 5 skills. These are just 2 of them. The social distance skill, it has 7 items, developed in the area of mental health, adapted to leprosy, validated together with Dadun, and we applied it. In the control area, we saw, so this was a cluster randomized control trial. In the control area, we didn't see any effects, but in the intervention area, we saw a reduction. We also used the SARI stigma scale. Yeah. Yeah. Yes. Oh yeah, I can see. Yeah. So the in the first graph, the red bars, they mean the baseline, and the blue bars mean the end line. And then we have 2 bars to represent the intervention areas and 2 bars to represent the control areas. So in the intervention area, we see a reduction. The red first bar goes down to the blue bar. And in the control area, it actually stays more or less equal. Yeah. The second graph, yellow and green, could have been red and blue also, but it's yellow and green, baseline and end line. But here we separated the combination of interventions. We see that in each of the different intervention groups, there was a reduction in stigma measured. With a large sample, or yeah, more than 200 people. Okay, yeah, okay. Next slide. Yeah, so for this, to assess the effect of the intervention, we use this design, which is called concurrent triangulation design. We had quantitative methods, we had qualitative methods, and we compared and integrated them. There are more type of designs. I heard from already your stories, some of you were thinking about a sequential design. When we think about a sequential design, it can be explanatory or exploratory. If it is explanatory, we start with the quantitative methods. We do this when we have good skills available, when we have good quantitative tools available. But then we might find something very interesting. Oh, right, this is interesting, but we don't understand it. So then we do a qualitative study to really understand the why. Why did I get this result from my questionnaire? Or why did I get this result? I need to understand it. So that's why I do a qualitative study. Another way forward is starting with a qualitative study. It's often when it's a newer topic or we're exploring something new. We first want to understand it and then see if this is representative for a larger sample. So I think some of you were thinking about first qualitative and then maybe a quantitative tool. Yeah, it's great. What is very important in this type of method is that we have the interpretation of the full analysis. Yeah. So if we use a sequential design, we can do so without integrating the results really. Yeah. And this is a missed opportunity. Yeah. So really, in all these mixed methods designs, focus on integrating, focusing on the entire analysis. Yeah. Sometimes we see, we use mixed methods and we have the tendency in our publication, first present the results of the qualitative study, then present the results of the quantitative study, but there's no real integration. So better to take a thematic approach, describe a certain theme and merge them, merge the findings, but that's a challenge. So this looks all very nice and neat, but the reality is often more complex, right? So in the SARI project, this would be a nice visual. Started with a qualitative study, an exploratory study, understanding leprosy and stigma in Cirebon. Then we did a validation study for the instruments, which involve qualitative and quantitative methods. Then we had our baseline with qualitative and quantitative methods. Then we had our end line with qualitative and quantitative methods. And we also kept track continuously. Qualitative research, observations throughout the implementation. not only at the beginning, at the end, but throughout, right? So this is a bit more, yeah. So I think, so also I encourage you when you are developing your methods, think about how would I visualize this? The capitals means it's more prominent. You can use sort of smaller normal fonts to, to give the weight to the qualitative or quantitative part. Yeah, but it can be helpful to use a visualization like this. Do I still have more time? A little bit? Okay. So then I just wanted to share a story about other research methods, because I think often we think about interviews and focus group discussions and scales. All these tools are wonderful. We've been applying them all over the world in different contexts. They have great advantages. But sometimes we need a different tool. We need to be a bit creative, not. So in this project in Thierrebon, it was a 4 or 5 year project. And at some point, every year in January, there is World Leprosy Day. It's a national day where we focus on leprosy. However, in January, Professor Zwekers will know, we have a very busy teaching schedule at the VU University in Amsterdam. So every year in January, I was teaching at the VU in Amsterdam, and I couldn't be in Thierrebon joining World Leprosy Day. So I would come in a bit later. So this time it was in April. I came in April, but I still wanted to learn what had happened during World Leprosy Day. What can we learn from this experience? So I asked the team to share me about World Leprosy Day, and I could have selected an interview to tell me about the day. I could have had a focus group discussion about the day, but instead, I asked them, because I know they took a lot of pictures, I asked them to tell me the story with pictures. Show me the day, use the pictures that they made, and tell me about the things that went well and the challenges that they experienced. Yeah. I also realized that this would have, it's a nice way, it would lead to a different story. But also, we don't put everything on pictures, right? We often put the nice things on pictures. So I divided the group in two. One group could use the pictures, but also refresh their memory because it was April and it had happened in January. So by looking at the pictures, they might, But the other group, I asked, don't use any pictures. You are only allowed to make drawings. Again, showing the strengths and the challenges of the day. And this was really interesting. Because when they started drawing, they were, sharing more challenges, actually. The spandoek, it's the first drawing, had been too small. And so it had been difficult for the people in the community to find the event. So actually you're probably better in. So they were very tired. They didn't have any breakfast. They were preparing the room. But there's also this very interesting one where there was a small discussion, you could say, to say it politely, between a research assistant and a health professional. They had a disagreement on something, right? We don't put disagreements on pictures. We don't put our small spandoek on a picture, right? So we need to, I think this is just an illustration. I like to encourage you to think out of the box when you select your research method. Sometimes we need something different. And I also like to encourage you to think about the advantages of your tools and the disadvantages. Yeah? Using pictures is great, but it has a disadvantage. You cannot, and not everything is put on pictures. Drawings can then help, right? What is the method not telling me? Yeah. So other research methods. The main point of this lecture, which you haven't really made yet, but I will do it right now. Mixed methods have the opportunity 1 + 1 becomes 3. But this is not a given. You need to work hard to make it a 3. Yeah? We can use mixed methods and only have a 2. to be honest, that happens regularly. Yeah. I encourage you, when you are using mixed methods, make sure you get to the tree. Yeah. Integrate the findings, make a compelling story with quotes and numbers, make it into a tree. Yeah.
Thank you, Dr. Rutt. I think this was a very inspiring story, showing very nice examples. I hope you enjoyed it as much as I did, also for the online people, which are now by now 103 people. Yeah, I have lots of questions, but I would like to open the floor first to all of you. Anyone? Yes, you, please. Floor is yours. Do we have a mic?
Can you please back to the slide in the visualization of the qual plus and the arrow?
Yeah. Yeah.
It's very interesting one. Yeah, this one. So it's pop up in my mind. So it's not, we're not limited the number of the combinations. Yeah. Qual plus quan, and then the other sequence is qual plus quan, and next one is quan plus quan. So I mean, it's not only limited into quantitative and then followed by qualitative, or maybe it's only parallel. So it's always repeated. So when will it be end of the research? So it takes 4 years, yeah, to complete the research. So I mean, what make us to limit the sequence, how many times repeated? It's depend on our question of the research, or what? Can you please more elaborate for this? Thank you.
Yeah, it's interesting. I think the whole panel can respond here. Professor Savedi, would you like to take the floor at first? Or about the sequence, the question clear?
It's challenging whether that sequence really fits or not. I'll just give an example. The ethical committee in Nepal asks you the full format of your proposal before you start. I mean, you have to have an ethical approval before you start. But when we do explanatory sequence methods, right? Then without analyzing qualitative data, you will not be able, without analyzing quantitative data, you will not be able to formulate qualitative data. Why qualitative data collection tools, why this is happening, why, right? So in general, what we generally focus is, basically in Nepal, I should say, concurrent mixed method would be the more easier. And sometimes students wants to link this, but they are not really mixing the methods. They collect some of the information for specific research question by quantitative data, quantitative methods, and other research question by qualitative methods, and claim that this is a mixed method. This is not mixed itself because they are independent to each other. So sometimes we call it a multi-method instead of saying mixed methods. Sometimes we are trying to make it more complex, and then if we make it more complex, then there will be more challenges when defending your thesis. If you are writing your PhD thesis based on publications, there will be so many supports by the supervisors and others because you have to publish all the articles, right? But if you are defending your thesis based on the whole dissertation, then there is a very challenging question all the time in mixed method study. And some philosophers in these days are asking, is it really possible to mix different methods having different philosophy? Qualitative methods have different philosophy. Quantitative methods have different philosophy, different assumption. And how are you trying to mix all these methods into one? And some philosophical argument is there, very strong. Though we have sidelined these arguments these days, and then I've been focusing more on mixed method rather than having only qualitative or quantitative methods. This mixed method is better one. We all agree. And then regarding the medical field, the qualitative method is not acknowledged yet. In the nursing, in the public health, in the social sciences, anthropology, qualitative method is acknowledged. But in medical sciences, qualitative method is not acknowledged yet, especially in graduation, post-graduation in medicine. So there will be always question to the medical field that how can you claim yourself that just asking 10 questions, 10 participants and writing the one sentence of their views, how can you generalize these findings in your thesis? This is not true, they would say. But on the other hand, those people who are from nursing background, who are from public health background, social science background, and other background, they would claim themselves that certain words mentioned by the participants are very, very stronger than that of the logistic regression or p-value highlighted in the quantitative research. There is a great theoretical philosophical debate. However, we have to compromise. The compromise is tradition or trend that most of the people are following. And then for that, either you follow the concurrent mixed method or sequential mixed method that makes off safe. I think, thank you.
Thank you, Professor Sabedi. And maybe in this audience, so I would like to add something. You think like, oh, my PhD is not about mixed methods. And now I learned that I have to do mixed methods. Yeah, no worry. It's also fine to use one of them. Some problems are really, really big. And then you need to start somewhere. So like Professor Dr. Ruth explained, you can either start qualitative or quantitative for a very good reason. And your PhD has an end. It's not that long, you know? So it might be that another PhD is following up your research and takes this next step. And then it will be not an integrated mixed method, it will be kind of sequential. And maybe at the end later on, somebody can mix all the data. So no worry if you think like, oh, I need to do my own mixed methods, because it's very good, also thinking about publications, to do it very thoroughly. And if you have a complex issue, it might be that you take all your time in your PhD to really find out what is this constraint and use more one type of method. Yeah, so in the end, I think complex issues, which most of you work on if I listen to the PhD stories, and we need a lot of data from different disciplines, but there's also a limit on the thing you can do. So there's also, so no worry if you only have one method, because that's also fine. So it's, of course, ideally it's this, but it takes a lot of time. So that's also your question, I think, an answer. Sometimes you have to be pragmatic. You can't do more in one PhD. But happily, there are a lot of PhDs coming after you, because all the questions we already heard, some will be addressed completely. Some probably leave a lot of different questions for other PhD to address. So I think that's also an adding to this point. Maybe it's now nice to take a few. Oh, yeah, very good. Yeah, no, please, Malin, is that how I pronounce your name?
Naila, yes.
Could you please share the question you have from our online audience, please?
Yes, there's one question from Irwandi Rahman from Hasanuddin University, all the way from Makassar. The question is, what is the main difference between explanatory and exploratory design and mixed method study in terms of the research question that we would like to answer in our research?
Yeah, I think that's a very nice question. Maybe that you can respond to that briefly.
Yeah. the main difference? Yeah. So yeah. So there's one slide. Maybe can we? I think it's one slide back. There we can see both of them actually. Sometimes in research we try to explain something. We found something and we want to understand why we did find something. So we're looking for an explanation. And then this first, the upper part of this figure comes into place. So there's the quantitative part. So we have this, for example, a scale, the quality of life scale. And there is a domain about well-being or like mental well-being, psychosocial. You might find some interesting results there that you want to explain. And then the skill is not going to be very helpful. You just know there is an issue, but you don't know why. You need to explain it. So you need qualitative studies to talk to people. What is going on in this domain? We call it an explanatory design. Sometimes there is a completely different situation where you want to explore something. It might be a new topic, a new study area, a new study population that we haven't understood their perspectives yet. And we want to explore what is going on. And then it often makes sense to do a qualitative study first, with interviews, focus group discussions, observations. And then we might find something and we might be wondering whether this is unique for this population or so we might want to have a bigger sample, gain some more insights into how prevalent the issue is, how many people are experiencing this. So then we might select a certain scale and do a more quantitative study. I hope this helps. Yeah.
Thank you. We hope this helps indeed. Now, if not, then please repeat the question. I have a new question for Laina.
Thank you. It's very interesting presentation about the mixed method designs. I would like to ask, one of the common issues in mixed method designs is that the data need to be transformed in a way, to allow the data can be integrated during the data analysis, right? So based on your experience, how do you resolve the issue of discrepancies between the different data types? Thank you.
Yeah, so yes, sometimes you find discrepancies and that's where it gets interesting. Yeah. So I can give an example from stigma research again. So when we use stigma, like these interventions, stigma reduction interventions, we use a scale to assess the level of stigma. Then we implement the intervention and we measure again. Sometimes the intervention actually raises awareness. So maybe before the intervention, people think, oh, yeah, leprosy and stigma, it's a problem. It's a moderate problem. Yeah. Then they hear the stories about leprosy, stigma. Maybe they meet a person affected. They become aware. Wow, this is not a moderate problem. This is actually a big problem. So when you then have the tool afterwards again, they would actually give a higher score, not because the stigma is higher within them, but because they became more aware of the issue. They heard this story, so the score is higher, right? Which is weird because you were hoping that the intervention would actually reduce stigma. The qualitative results will tell you something different, right? They will probably actually show the reduction or a better understanding. So then there is a discrepancy. Yeah. So this is, I think, when it gets interesting. And it's why you need qualitative research to understand the differences. Yeah.
Yeah. Just one more sentence. If you are doing concurrent mixed methods, so you will be writing convergent finding, the similar findings between qualitative and quantitative. But at the same time, you will be also writing divergent findings between qualitative and quantitative and expansions of the findings. So in that way, you can address the issues there. Thank you.
Yeah.
Yeah. Basically, in qualitative research, it is said that if we are not that much clear about the the responses that our study participants have made, that should be resolved by member checking, whether they have mentioned exactly the same way that we have been writing, because most of the interview will be taken in local language, and then report will be written in English language. Sometimes there will be difficulties whether that was the real meaning or real understanding of the participant if the researcher are from outside the local context and who are not qualified about the local language.
Thank you. And I would like to add another one, because now it seems that we are just measuring at a certain point of time. But if you look at the questions we already had, and I'm very interested in the next couple of questions from you, sometimes you would like to make a change. Like you want to increase breastfeeding at the hospital, or you want some people to do something different after your research. Then it's called an action research. You would like to change something. And of course, if you like to change, then you're happy that you find different findings along the way. Also in Ruth's research, the stigma research we did, you can see that we want to change. And then a change, you would like to do different methods along the way, and they were happy with different findings, because actually you would like to have the change. So I think also what you asked, Lima, is this. So if you do something, as soon as you come entering a research setting, you do something with that as well. So it's not a laboratory where you put two things together, you see the color change. This is real life. So like the stigma is a nice example. By mentioning stigma, you can increase the stigma as well. So I don't dive into it, but a lot of ethics here around as well, what you do as a researcher. So we presented here a little bit as just taking data and do something with that. But it's way beyond only taking data. It's really doing something in society. So action research, we don't dive into it today, but I would really mention that as a tool which you use different kind of methods, different type of mixed methods you can use, but a different way again to deal with your data. Yeah, but I leave it now for here. I think we take another few students to learn briefly what is your research, and then we dive into community-based participatory research. If you have further questions, hold them, because at the end we can dive into a lot of different directions further. Can we have the mic back to Leila? Is that how I pronounce your name? So you can briefly tell what is the topic and do you use mixed methods or not for your PhD?
Thank you. Good morning. My name is actually Lela.
Lela.
Yeah.
Okay, thanks.
Okay. For my research, I plan to develop a model about optimization of UKBM in primary healthcare at the coastal area in Maluku.
Okay, thank you.
Provinsi Maluku, which is our geography is an archipelago. Most of the people live in coastal area, and I would like to develop a model which can make the primary health care for the people in coastal area are more increased because of lack of control. Our geography it's a very hard to make a gradual control from primary health care. So the model I hope the model which is I developed later more helpful for the primary health care people to control the what is kadar kesehatan masyarakat ya.
in in English. I'm sorry. Yeah.
Community.
To gain control from kadar kesehatan masyarakat, so it will become optimization
Yeah, nice.
in their in their
Environment.
activities. Yes,
Yeah.
it's kind of
Okay.
that. Yeah.
Thank you very much.
Thank you.
Could you pass the mic
Okay.
to Marta?
Finally, my name is Marta. My research is about safety, occupational safety. It's about analysis interaction between unsafe condition and unsafe action related to the accident. Actually, I'm in searching, yeah, I'm in learning on how we do analysis better for this research. Basically, we do quantitative analysis, yeah, on how we analyze the investigation accident data. We found in accident investigation data the root cause and direct cause of accident, which is we found the data of unsafe condition and unsafe action. Mostly of the result, yeah, the data is just let them without do analysis the interaction which is contribution having contribution to the accident. And we also do the analysis the qualitative for the on how we do prevention for the accident. It's still my in my question, yeah, on how we apply the mixed method on this research on regarding we want to know the deep answer on how we eliminate or minimization the accident happen in our industry. This is my big question on how we can apply the mixed method. Thank you.
Thank you. Very interesting research. May, could you briefly explain, try to keep it brief because we have a lot of people and we would like also to share a lot of stories from our side. So keep it brief. What's your topic and do you have, what kind of methods do you use? Yes, thank you.
Hello, my name is Yanti. My background is pharmacologist, and my research, the topic is implementation of pharmacovigilance for successful tuberculosis therapy in first level health facility.
Okay.
And mixed method use to explore, and I continue to quantitative to develop instrument.
Nice.
But I have a question in your study, study, what was the sampling design in your study? So can you have 200 patient to 200 more, yeah, patient for score study. How you can your method sampling for your study?
I saved the question, May. We put it on the list. So sampling is for you later on. I now go to Anis, and we collect a lot of questions. We try to address them later on all.
Okay, thank you. Good morning. Actually, I have a question, but because it's related to my research plan about health-related quality of life, and you said you evaluate the quality of life also in your research, and I want to ask about what instrument did you use in your study? Because I see that you use a contact intervention, but I think I cannot that technique cannot use in communicable disease like tuberculosis, because my research plan is I want to see a correlation about health-related quality of life with immune system in tuberculosis patient with diabetes mellitus. So that's my research plan. Thank you.
Thank
And the
you.
question is about the instrument that you use in your
Yeah,
study. Thank
we
you.
noted it down. Thank you very much. But we move now on to Ruli.
Okay, good morning and thank you for the opportunity. My research plan is about to make or to try to make an instrument to analyze the readiness of tuberculosis care village, because because somehow we know that it's a policy that comes from top down and not the bottom up from the community itself. So I'm interested to know the readiness of the community, the cadre, and also the health professionals in each kampung or kelurahan.
Nice. Thank you very much.
Okay, thank
Ruli.
you very much.
Please pass it through to Nouri.
Okay, thank you. Good morning. My research about hepatitis B hepatitis, we use secondary data from basic research data in Indonesia. We need find how many percent disease of hepatitis, and we correlation with facilitate health research data also in Indonesia. So we need to know how to cover hospital or primary hospital ready to cover about this disease.
Okay, thank you very much, Nouri. We go to, I can't really see your name, Tanya.
My name is Tina.
Tina.
Thank you very much. Good morning. I'm planning to research about spatial analysis of environmental sanitation quality and its correlation with the occurrence of communicable disease in stunt toddlers in Maluku. And I will use maybe quantitative study with statistics spatial and multivariate maybe, but I think if I use a qualitative study, it can be more explain about risk factor about stunting in Maluku, maybe. Thank you.
Thank you. For the others, please pay attention to the other ones. That makes it also easier to listen to each other. So please, I will give a break later on so we can chat along, but please pay attention to one another. Lina.
Yes, thank you. My research is about healthier food system for less overweight and obesity among children. So it's a focus more on the food environment. For the quantitative method, I will use this method to assess the prevalence of overweight and obesity, as well as what are the children eating. And then from the qualitative method, I will use this to identify the reasons on the food choices of the children, as well as to identify the food environments that surrounding the children. And then we can decide or identify what are the intervention in the food supply chain, for example, and then a package of action or intervention to create healthier food environment for the children. Thank you.
Thank you very much. I think we are in need for a break. So I would suggest to have a small break, just move around, chat whatever you want to chat, and then after that we will be quiet again and listen to each other very carefully. But now move, leave these chairs, 10 minutes, do something else, go to bathroom, whatever, 10 minutes sharp, we will be back. Yeah? So watch your phone, 10:10, it's here. Yeah? And quiet 10. Thanks. Also online, in 10 minutes we will be back.
To the participants online, we will have 10 minutes break and we will start again at 10:10. So please be back in 10 minutes. I repeat, please be back in 10 minutes because we will have a short 10-minute break.
Ja, ik dacht later. Dat vond ik zo. Even de wandelen. Can I ask all participants to join us on the table? Also for online, we're about to start.
To all the participants, please enter the seminar room. We are about to start with our session. To all the online participants, we are starting the session right now.
So we continue. Please, final person, take your seats. I hope you have some more energy for this second part of the session. I suggest we start with community-based participatory research presentation of Professor Saberi. I think I'm very interested to hear all your stories and experiences in Nepal. Please, on the table, be quiet, listen to the story, and save your questions. Analyst, unless they're urgent, raise your hand, and otherwise be silent so we can all hear Professor Saberi talking.
Thank you very much, Professor. I'll be talking briefly about community-based participatory research experience on social science field. Experience on social science field. My presentation outline is a community-based participatory research, a brief about its definition, role of social science in community-based participatory research, and my own personal experience while working in a project. This project is very much related to menstrual exclusion, mainly dominated by Hindu community. I will also learn whether there is menstrual exclusion practices here in Indonesia or not. And then how did we start this project? Can you? Yeah. Yeah. When we talk about community-based participatory research, this is an approach to increase the value of studies for both researchers and community being studied. The researcher will learn from the community. At the same time, the community people will learn from the researcher. This approach is particularly attractive for academics to address the persistent problem in a variety of population, since the academics do not know all these issues and they should learn from the community people. If they work together, both the group will get benefit from this kind of research. This is a collaborative research that is designed to ensure and establish structure for participation by community affected, the issue being studied, some social problem, health problem, for example, with the representative of the organizations and researchers in aspects of the research process to improve health and well-being through taking action, including social change. When we talk about community-based participatory research, we generally say we use transformative approach. We want to see the change in society. We just not want to explore what is there, but if there are certain problems, then we want to change it, working together with the community. The academics plus community, they work together. Sometimes we call from knowledge from below, expertise from below, and knowledge of the researcher and expertise working together for the benefit of both the group. The researcher people will get benefit from the local people's knowledge. At the same time, the community-based participatory activities will go in the action and see the change. This process involves co-learning and a reciprocal transfer of expertise, learning from below and learning from above by all research partners, with particular emphasis on the issue that can be studied with community-based participatory research. We can share the decision-making of the power and then mutual ownership of the project, whole project and findings is one of the key characteristics of this kind of research. I'll just jump a couple of slides. For example, I started my career in 1993 after doing masters from sociology, then still teach Tribhuvan University. But later on, I joined the new university called Patan Academy of Health Sciences. Currently, I'm chair Department of Science and Public Health. I'm also visiting faculty in Nepal Open University and visiting faculty University of Khobda, Sweden. My basic focus and teaching is much more about social determinants of health in public health, issues of gender, ethnicity, place of living, social class, occupation, education. We focus on society, importance of society, culture, and health in medical science, in public health and nursing. Later, we have also started humanities, medicine, nursing, and public health, value of qualitative research. And basically, these days, dignity is very important. Dignified life of people is very important. That's why we call, traditionally, we used to say leprosy affected persons. Now we say persons with leprosy. First, he or she is a person, then afterwards, I have leprosy, or persons with disability. Previously, we used to say disabled person. Now we have to say we have to respect them. Dignity is important, and equity and social justice, we focus on this. I will highlight an example of community-based participatory research working with the team. The title of our research was Dignity Without Danger. collaboratively analyzing stigma and taboos to develop innovative strategies to address menstrual exclusion in Nepal. This project was funded by British Academy Global Challenge Fund, and it was supposed to complete in December 2020. Because of this pandemic, it was completed in December 22. So this was the team, research team. You will see most of the research team, only few are males. Most of the research team members are females, because traditionally it used to be shared that menstrual issue is a private issue. This is an issue of concern of the only female, but this is not the case. So this was a collaborative action research, rapid ethnography we used, and we recruited research team in 2019, January 2019. We all together, there were 3 universities and 6 local NGO partners. We studied this research, we conducted this research in all 7 provinces. We have 7 provinces in Nepal. This is a team that we organize, the orientation team with all people. With since we were talking about menstruation, that's why you could see red clothes over here. Many people, we use the same jackets and we worked, and we invited NGO partners and had training. What are the current practices and challenges in the field of menstrual exclusion? Although there are diversity of menstrual exclusion between rural and urban, between educated and uneducated, between having services and having knowledge of medical science and not. But most important factor is deep-rooted cultural, religious values and practices. That was playing very important role, where the field researchers training. And then we went to the field with the help of local NGO partners. We did not, the field research team did not stay in the hotel. They stayed at the house of the local people with the help of local NGO partners. We did kind of much more conversation about that. How is life? How do they do it? And what are the challenges? What are the practices? Has there been any changes between the generations? What are the menstrual practices of their grandparents' generation and parents' generation and young youth generation? We discuss much more about informal talk, sometimes what we call choreography. And then we also discuss with the different healers, priests, and mother groups to understand this deep-rooted phenomenon in the multiple ways with multiple dimensions. And we did field work in different parts of Nepal. So after having preliminary findings, then we share our preliminary findings in an international conference that was held in Kathmandu. The title of our presentation was Dignity Without Danger, Opportunities and Challenges of Engaging Partners in Collaborative Action Research. That was a very good opportunity. At the same time, we faced challenges, including challenges of this pandemic, including the challenges of the higher level of expectations from development partners, NGO partners. But we learned a lot while working with them. Then we found some exclusionary practices. During the menstruation, certain foods are excluded to eat and to drink. These were different. female were not allowed to touch specific things during the menstruation, and there were issues related to access to public and private spaces. I'll show you a few examples that might not be practiced here in context. I'll learn. I'm eager to learn here, but menstruating women should not consume milk products during menstruation. If they do, what happens then? And there is the very popular saying that the cows will produce less milk, will bleed from udder, and will kick while getting milk. If this is the scenario, nobody would violate the rules. If we look at from all these issues from feminist point of view, feminist perspective, then we could say that this is structural violence, right? So they are not allowed to consume water from holy water sources during their periods. Then what happens? Consuming sacred water is expected to cause illness to the menstruator. They are not allowed to see the faces of the male family members. If they do, what happens? It causes sickness and shortening of lifespan of the family members. These were the very typical findings. Because of all these, when rules are broken, what happens? Because of all these, the deep-rooted cultural practices, nobody wanted to break the rules, whether they are educated or not, whether they are from rural or from urban background. Although, if we look at from the generational changes, if we look at from comparative perspective, historical comparative perspective, we can see the change, but these values are still very strong and rigid. So there were other issues like access to kitchen. You are not allowed to go to kitchen. What happens then? Food served from kitchen in which menstruating women have been will cause sickness to anyone consuming such foods. So very powerful, value system is loaded. So they will not break the rules. And they are not allowed to take part in rituals, for example, marriage, ancestral rituals, religious festivals, and the restriction is extended to the husband of menstruator in case of major rituals, for example, death rituals of the family. If they break the rules, rituals are not effective when menstruators take part. These are mostly the Hindu value system in our context. We found it. At the same time, when we interacted with the different mothers and then women, then we also found that there are the different practices, differences into different areas. So there are certain institutional practices used by the healers. These healers had very prominent role or key role for the continuation of such exclusion practices in our context. They were reinforcing such practices. They were saying that if you don't follow the traditional rule and norms, then it will destroy the societal norms and values. If you don't follow rules, then there will be kind of events, wrong events, or the family members will be sick, or animal will be died, or there will not be any rain in your village, something like that. And then nobody was, interested, or nobody had challenged. There are some activists who have been challenging all these issues, but these activists are far ahead compared to other people. So others are not able to follow her. So we also discuss with them, are they ready to change, to modify the practices? If yes, what can be done? How do they follow right now? What were the practices during their childhood period? What were the practices during their menarche? And what is there? All these issues were discussed with them. And then we also found there is religious cultural variations. Cultural practices, variations, some priests, religious people were liberal, some were still very rigid, some were saying themselves that, oh, we don't follow all these exclusion practices in our home, when they interact with the outsiders. But in reality, situations are different, right? In their home, they would practicing the exclusion practices, but if you interact with the outsiders, then they would say, no, in the past we would do it, but now things have been changed. But reality we found different. So social stigma and taboo was also there. People had difficulty to buy pad. They were using local clothes as a menstrual pad. And based on this, we share our finding into different conferences. And then we engage stakeholders, we engage local mothers, and we invited them to share their findings with the local political leaders. And we invited them to talk with the local political leaders, what can be done for the betterment of this issue. We also share some of our findings in journal, Menstrual Exclusion in Nepal, some evidence of transition. So we share this in the conference and then publish it. We also invited the menstrual activist and then celebrated menstruation in Nepal, Menstruation Day. We wrote a very kind of small article about it. My colleague with the PI of this project, Sarah Parker from Liverpool John Moore University, and myself, we work with them. We celebrated that celebrating menstruation in Nepal. We also did it. And then based on all these findings, we developed certain creative outputs, kind of knowledge, small videos, menstrual education toolkits, and then what to be done when they are menstruating. We discussed with the political leaders, local leaders, and these political local leaders were very much positive, because we just wanted to change the value system slowly and gradually from the household level. We did not much more criticize that what priests were saying. We were not very much critical what their grandma was saying, but we were discussing about, look at this, the things have been changed. Supportive materials are easily available these days, and there are some misconceptions that has to be changed, and then they took it very positively. And we also share these preliminary findings in London. Unfortunately, I couldn't make it there because of this pandemic and my own personal work. And then we printed more than 100 pages this book, Celebrating Menstrual Activists in Nepal, in English and in Nepali local language. And then we distributed this into different organizations who were involved in this research. And we also distributed digital copy, basically in local language, to the mothers who were involved in this work. And then we also, visualizing menstruation in Nepal, we also organize a program and then discuss about this. Many people, including political leaders, appreciated this our work. And then final conclusion is religiously sustained culture of blame exists or considered acceptable, the practice of menstrual exclusion will continue. So demystification is very, very important. In hierarchical society, people generally blame the powerful people, blame the less powerful people, weak people. Until and unless we change it, this process will continue. The legal intervention is very important, and then legal intervention as well as the intervention at the community level with the people is very, very important. Stigma and taboo should be considered very seriously, because this is also very much related to the dignity of life of the women, because there are so much restriction practices in the community. We did some kind of co-creating and co-designing activities to reduce the harm, and that worked a lot. And then we are much more happy with the activity that we did with the local community people. And then the intersectional approach is very much needed. A blanket approach is not feasible in many contexts. In some people are very much rigid, some are liberal. In some religious context, they are rigid and some are liberal. And there is variation between East and West, North and South. Thus, the context-specific planning played very important role to minimize the stigma and taboo in the menstrual practices. I'm not quite sure whether we'll have a time, but there is 15-minute video, but maybe we don't have time right now. If you are interested, I have shared a copy of it. You can just click. You can. This is a song developed by the local mothers, and then this is much more about awareness about these menstrual practices, and then how to minimize menstrual practices within the households, how to demystify the menstrual practices in the village. This is the core information given in this video. If we have time, we can watch it. If not, if you are interested, you can watch it later. Finally, then we found this is the kind of final remarks that there are some important issues. Human rights issues are there, gender equity issues are there, health issues are there, WASH issues are there. So educations are very important issue. Then these all issues are also related to Sustainable Development Goals 2030. So policy advocacy and education awareness are very, very important issues. So these 5 areas are identified, and we have been discussing more about all these capacity development issues. How do we continue? The continuation has been very challenging, and then this will not be sustainable if we just do one step. Say for 2 years, all these sustainability and continuation of these kind of activities are very crucial. And then we have been lobbying to the government of Nepal and local government to advocate all these dignified menstruation issue in Nepal. I think this is my short presentation. Thank you very much. If there are any questions, I'm ready to answer. Thank you. Thank you.
Thank you very much, Professor Sabedi, for a very interesting presentation. It's very nice pictures that show the setting, so that was very helpful. But in relation to the video, I also think we can better use the time now for discussions because we don't have so much time. But maybe for the online people, we can already put the link in the chat so they can copy it and watch it later. And for the audience, it will be made available to you. I see we have at least one question online. Shall we start there?
Yes, thank you very much, Professor. We have one question from Siti Sopiatun from Universitas Indonesia. Okay, so she asked that how is this method can be applied for community involvement. So they are doing research and community involvement in early detection of preeclampsia for context. Yeah. So they're asking, how could we use this method for the research? Yes.
Right, right. In eclampsia and pre-eclampsia is very, very important public health issue, I should say. And then this kind of methods can be used on these issues. Then one of the important thing I think would be to focus on the target group, to focus on the target mothers. What would happen during their pregnancy, and what are the certain preventive measures, preventive measures. So one of the important strategy could be, what are the danger sign and symptom of pre-eclampsia and eclampsia. So if we are able to work together with them, with the scientific team and the local mothers, and what are the possible ways to prevent them, one, and second is to get access to health facilities and to get health services as soon as possible. If we develop this idea with the local mothers, depending on the local context of health facilities, probably this method would be helpful to prevent eclampsia and pre-eclampsia, I think. Thank you.
Thank you. Can I add some more here? So thank you, Professor Sabedi, for that explanation. What I would like to add here as well, that if you do community participatory research, building trust is very important. So, and you have an advantage if you are local and do local research. That helps because it helps building trust. You can imagine that we walk around in Indonesia, we don't have trust rates from the start. So what Ruud, for example, did is learn a local language. That helps. But it goes way beyond. So even you need to build trust in local communities. Living in Jakarta, moving to Cirebon, for example, you need to build trust. How to build trust? Anyone? Yeah, can you change your name tag so we can... How would you build trust, Harlo? Hario?
Yeah, based on my previous experiences, so we have to find local leader. Maybe that's one tips, and then we can communicate with the local leader or the someone respectful in that area, so that the community can follow their local leader. That's one of the tips.
Yeah, very good.
To gain the trust from the community.
I think it's a crucial step to find a local leader. I see another hand, so let me give the mic. I can walk. Yeah, we have more, but I can also walk, no problem.
Okay, maybe based on my experience, because now I'm running my research for the first step in qualitative research. I built the trust. Well, before that, I have to tell you that I'm doing my research. I'm a Balinese, I'm a Hindu, and I'm doing research in East Nusa Tenggara. It's very different culture there. So I need to build a research. Before I'm doing the contact with community leader, I live with them. I'm doing everything with them. I'm participate in everything with them. I'm cook with them and eat with what they eat. And I participate in every way with them. So I understand how they live and how they way of thinking. And I exploring more about East-West Sumba region.
Nice, thank you. Another very good strategy to build trust, to become, I would say, almost friends, like you did. That's crucial, especially if you talk about these sensitive issues we were just addressed. It's very hard, and also for gender, it's more difficult to talk about menstrual problems, things like that. So building trust with these examples, go to the local leader, live with the people, get to know them, is crucial, especially if it's about talking about sensitive issues. Yeah, anyone else who would like to respond to the trust? Yeah, please.
Along with that, ma'am, we can also involve the celebrities of that specific area. The celebrities, because people listen to the celebrity figures. For example, in our country, like there was an issue of diabetes, young age diabetes. So what we did that we have a sportsman, we have a cricketer, Wasim Akram, and he's a young age diabetic patient. So what we did that we like introduced, so we invite him to shows on awareness of diabetes, that if you are suffering from diabetes at young age, you can still live a healthy life. So we can also involve celebrities for that purpose.
Very good. That's also a strategy indeed. Very useful. And I would like to provide another example, because now we had an example of which, like this example, to like the menstrual thing. But another example I would like to give from Tanzania, where local females prefer to give birth to children with a local birth practitioner. And that means that it's in the house, it's completely different practices than in the hospital. However, a lot of babies die during giving birth. So what to do? So instead of telling the women you should go to the hospital, because they won't, they prefer the traditional practices. So what we learned, and I did this research with a lot of my colleagues, we learned a lot from the females, learned a lot from the local birth traditioner, as well as the doctors. And what we did, it's a long research, so this is taking 4 years, because you can imagine you can't change it all of a sudden. But together with the doctors, local birth traditioners, and mothers with children, we developed a practice in which in the end, so I just hopped to the end of the research, the local birth traditioners are joining the ladies to the hospital. And as long as possible, they practice these practices in hospital. And when, according to doctors, medical activities are needed, they will step in. And you can maybe imagine how hard it is for a doctor, because the local birth traditioners, for example, they give birth on the floor, not on a bed. You can imagine that doctors don't prefer being on the floor. They prefer the ladies to be on the bed. So a lot of these things. So it was very hard to make this work. But we managed, of course, a lot of steps need to be taken, because it's not a general practice now. But we have made the first, I would say, tiny steps. So it happens now, some doctors, because not all of them want, so it takes a long, long process. But I think these are also steps you can see, you mix the knowledge. That's how I like to use the example. So to see what is allowed from the local birth traditions, what is allowed still for the doctors, and how can we in the end, because in the end we would like to save the lives of the mother and the children. So how can we make that work? So you can also come to results in which there's real, I say, mixed knowledge, really co-creation, and none of us would have come to this solution while we started this research, So it also shows what I said is action research. You can come to new ideas, new solutions no one would have thought of when starting the research. So therefore, I would like to give this example. And you can imagine that trust, in also this case, is a huge thing we're talking about. Yeah. Okay. Any other questions from the floor? Yes. Are you?
Thank you for the opportunity, Professor. Based on presentation from Dr. Ruth and Professor Subadi, it's very interesting, and it's related with the research with what I'm done today. Well, I focus with my research is about community empowerment based on social culture to prevent malaria in pregnant women through increasing the uses of LLENs, long-lasting insecticide nets in Southeast Sumber region. And now I'm in the first step of my research. It's qualitative research. So I using social culture to becoming approach to make a strategy. So it's a really CBPR approach that I have to do. But the problem is, yes, I live with them. I participate with everything with them to build the trust. And as you know, or maybe a little different with Professor Subadi did, that about menstruation, but malaria is not a new disease. It's an ancient disease. So I want to know how to increase the awareness of community about the health problem, because as you know that malaria is ancient disease and they already have a perception and ritual and many as Asian ritual, there's so many ritual for a sickness and the malaria based on them. And I want to put health science in the traditional ways, combine them and how to combine it. And I already collect data from qualitative. I found so many data and how to integrate it, the finding. I have difficulties about it. Maybe both of you can give me some suggestion or based on your experience to help me so I can use that my finding from the qualitative. I will use it to make a design strategy with the community and we'll try it. Yeah. Thank you.
Thank you,
Yeah.
for your
Welcome.
question. Dr. Subedi,
Okay.
would like to respond first? Just,
Thank you very much. This is very important questions from cultural perspective. First of all, we should understand from the perspective that why do people not use nets, for example, right? So I can remember one of the books written by very famous Professor Arthur Kelman, who published in 1980s, Patient and Healer in the Context of Culture. And he mentions very rightly the explanatory model. All people do have their own logic in their head, and that logic's work. Sometimes what happens, our understanding, our interpretation, and their understanding and their interpretation differs. So first of all, we have to forget our own understanding and try to explore their own understanding. Once the data comes up on our table, then we have to use science. What is right, what is wrong. And then once we are able to right practices and wrong practices, or harmful practices and beneficial practices, we should make a project, intervention project, to minimize the harmful practices and to maximize the beneficial practices and to show the example with them, right? It takes time. This is much more related to health education and changing the behavioral practices, but this is the way that only you can do it. First, we have to forget what is right and wrong. Just try to understand what do they think in their own way. We have to look their one perspective rather than our own perspective. Probably this is the right way you can do it. I'm sure you will do it. Thank you.
Thank you, Ayu. If I can add here, my example just from Tanzania is exactly the same, of course. Why do women prefer the local practices? So it's a lot of learning, and therefore I say the time frame was huge because we had to learn a lot. And if people prefer local birth practitioners, and also malaria the same, you don't see directly the effect. So when people die after giving birth, for them it's maybe not a clear direct relation to the practice. And of course, also in hospitals, some people die. So for the community, it might not be clear that, so the cause and the effect is not clear. They have more trust in the local, also trust in the local birth dietitian than the hospital far away. So this question wouldn't be possible. It takes a lot of time. So the time comes in as well. So don't, you can hope, but I don't think you will get to solving this issue malaria in your time frame. So it takes way more time. And in line with Professor Savedi, please understand why they do things they do, because sometimes underneath these values, there are similar values. So underneath, there are similar things why they do it. And then you would have an entry point, if they know it. So you need to find this under, and it's so interesting to learn these things because it's complete different. So if you're really honestly interested in how they believe it, it becomes way easier to understand. But basically, you are the one that is ignorant. Although you did your study, you have your master's, you have your bachelor's, you're the one that doesn't know. So that's very good to realize. If you do this type of work, you're the one that is ignorant and you're the one that needs to learn. And then if you understand it, then the interesting question comes, okay, where do these things meet? If it doesn't meet at all, I think the chances of success are very low. So you need to find angles where you can think, yeah, but it's underneath. So you really have to learn how they believe that it's working. And that's, I think it's very interesting. I love to learn. So, but yeah, that's what you need to love. Yeah.
I also like to add something. Don't see this as that you're on your own, right? So even so, you might have analyzed the data, but use a team of experts, a local people, again, to explain, to help you with the interpretation of the findings. And also, you don't need to develop the intervention alone. Create a team with representatives of the different stakeholder groups and do this together. Yeah, I think that's it's not only about the beginning phase where you involve everybody, but do this throughout your research. And work with others. Yeah.
I have a question for the audience, because I think it was already in these discussions, but there's another thing that's very important, and that's the word power. I don't know whether it mentioned that strong already, but power, that's why you go in the first case to the local leader, because he has the power. So if he trusts you, it will go there. But what other effects can you think of when you're thinking of power in communities and in relationships? How can we deal with it? What kind of problems can you face with power? Anyone? Okay. Hario?
Just come up in my mind is abuse of power. So when someone neglect the moral values, they can abuse the power. So use the power to just for her interest or his interest.
Yeah,
maybe.
Yeah, for sure. You can misuse. Yeah, definitely. Any other things in relation to your own research? I promise you, you all will, if you go to the field, face power challenges. So you better think of it right now before going to field. What issues can you face? Angie, can you mention some? What challenge would you face going to the field if you talk about power?
About my research?
Yeah.
Challenging is data, sample size or big data I will use to develop some indices to my research.
Okay, and what power issues could you face?
Oh, micronutrient deficiencies. Power issues about micronutrient deficiencies, about public health issue. Micronutrient deficiency.
It's your topic, right?
Yes.
Professor Marjolein asking about the power. The fields, you will face power, right? So how you handle that?
Yeah, I don't mention the statistical term, but the power in relations. So
Yeah.
really social power.
Maybe some gatekeepers.
Gatekeepers.
Yeah, there could be a gatekeeper. For example, if you go to a household, yeah?
Household.
If you just enter a household, who will you think you will meet? Who will speak to you if you come as a strange person? Who will meet you then in the husband, yes. If you talk about menstrual problems, do you think the husband is the right person to speak to? Parents. But if I talk about the subject that Mr. Subeti just talked, I want to talk about menstrual problems and I get the husband to speak. Is that the person I need to have? Who says no? Raise your hand. Who says no? Who says yes? I do. Maybe I'm the only one.
It is very important to talk with male. Until and unless you speak with males, you will not be able to change. Since she was mentioning, the professor was mentioning about power. If male are the decision maker at home, if you don't communicate, if you don't discuss with them, you won't be able to see the change. So, though many people say that this is a female's issue, but this is not the issue of female. This is the issue of whole human being. This is an issue of human rights. This is an issue of dignity. So, powerful people, we should discuss this issue with the male also, not only female.
I agree. I agree. And also for building trust. If it's the rule that the husband, then that's the one we speak to. So starting with the community leader, starting with the husband, and go all the way. Build the trust, and then you, but definitely also the other persons in the household are very important. Like Ruth just told about the stigmatizing story. Who do we speak? Who do you think when Ruth went into the village, she passed the community leader, she went to the household, spoke to the husband, then who will be the next person to speak to if you would like to, in the family, there's one person living with leprosy. Who is then the next person to be asked? What are you going to do? The neighbor. Yeah, neighbor would be nice to talk to. Yeah, anyone else? Who do you meet? If you want to do stigma, leprosy, and cerebon. The neighbors, the husband, who else? Parents, yeah, very good. Who else? Friends. What would be differences in their stories? Would there be difference in their stories, or would they be identical? I see you're nodding. Why? What could be a difference?
A little different, ma'am, because for example, the specific person have different relationship with the parents, and it has different relationship with the friends and with the siblings and with the neighbors. So if you communicate with every single person, they will present a different perspective of that single person.
Yeah, very good. And with stigma, it's really two ways. Huh? If I am the one that is stigmatized, I feel different than I have an idea what she's doing to me, but probably she has a different idea what she does to me. Yeah, so we will have a complete different story most likely. So it's very interesting as a researcher to know then both of the story to make your picture complete. I like to speak about pictures, about situation. And when I start making this drawing, I don't know what I'm going to draw. And slowly by speaking all these people, slowly my painting becomes a picture. And it becomes more and more clear for me what to do. But you have to be aware that when doing this, power and trust are so crucial, and think of them before you go to the field, because people will memorize. So if you make the mistake just going there as directly for the female and you hurt the male by passing or not following the rules, they will remember. The negative memory of people is very good. So please be aware you do it very nice and gentle, and you have the benefit, most of you will do local research. So you know a lot about the local content. So in that step, if we are doing research here, we're way lacking behind you. So that you already have an advantage, but still, it's still different and you need to still learn. Okay, any other questions related to this? Yes, Marta.
About the power. In my religion, we asking to the religion teacher on how we believe human being, in as a community, about men and women. We have the rule on that. So depend on the perception of or the belief of the human, they can do the better dignity.
Nice, very good remark. Religious leaders are very important. Actually, I would say that almost anyone in the village will have an interesting story for you. So if you do qualitative research, think carefully. Of course, not always possible to interview everyone, but think very carefully who you need to speak and what would the way to go to this person you would like to speak to. Yeah, that's very important to think about. I would like to, although I see a lot of more people have joined us and we would love to hear all your PhD stories, I think we move on to the final part of the session, the publication, because that's also very important for you. And at least we get a very good indication of what you're all doing. And again, we would be love to hear all the other stories. So let's see how we can get to know about that. But to make a start with this final part, because we don't have a presentation, because what I told you in the beginning, there's no recipe book how to publish in international journals. Did we do it? Yes, we did. So we know a lot of the different ways and strategies, and we would like to share them with you. And we also want you to ask a lot of questions to us about these publications. But I would like to say some general things about publications in international journals. First of all, there are lots of journals. It's a whole world open in journals, and they have different, as it's called, impact factors. And as a researcher, you hope to get in the highest impact factor. But sometimes it's also difficult to publish in high impact factor. So as a starting point, I would say a lower impact factor is nice. An impact factor is important if you talk about international publications. It depends also quite a lot of what type of research. If you really do transdisciplinary research, it's sometimes harder to get in the high impact journals. So I would say, especially as a student or PhD student, publishing your first article, aim for not the highest impact factor. But be aware of it. Look around, see what's out there. You don't have to all publish in the Lancet. There's a lot more going on than that. Okay, after doing that, you have your research question, you know your results. It's good to see what is the good match with your journal. What's the aim of your journal? What's the aim of your research? What do your research results show? What is a good fit with journal? Actually, I challenge my PhD students always, find the article you want to write in one of these articles. There's always somebody did research that comes very close to your research. Find that. Find that article in that journal. Next step is to, I hope you did it in the beginning of your research, but you need to make sure before you start, so actually before you start the research, you would like to know, explore, probably somebody else somewhere in this whole world has thought about this before me. Somebody else in this whole wide world probably did some research quite similar to mine and has published about it. Get to know that research. Know what's out there. So when you write your article, you show that you have read that and that you come to like, okay, they did this, they did that, but I have a gap here. No one, that's my gap. That's my research. But show, and that's what you need to do in the introduction. Show very clearly, this is the gap I found, and this is the research I'm going to do. So, but actually, you need to do that before you start your research, of course. So I talked to some of you, and I know you need to do a literature search. That's very important in the beginning of your research to make sure you have identified your gap. Then what all journals want in different ways is that you show, you know, the theories. Some have a theoretical framework, some have a theoretical background, some have another type to deal with theory, but most journals, not all, but most have a clear theoretical perspective in it. So also see how your work, your results relate to the overall theories that are available. And it differs per article how it shows. Then, of course, the results. We already talked about it. They're very, very crucial. So do this very carefully. And people would like you to write it down. Either to be able to copy it, but in most cases they can't copy, but they want to trust you. Again, trust. They want to understand, why did you do the things you did? And did you do it carefully? So how did you do the analysis? How did you do the selection of people? All these steps you need to make sure you describe. Also the ethics. So all these steps you have to take into account before you start your research, because you never can go back. When you have your results, they're there. So make sure you do this nicely, very nicely before you start your research. Make sure you make enough notes that you can come back. So people at least understand without having to copy your research. When I read the research just presented by Dr. Sabedi and Ruud, I need to know what exactly they did, that I can understand what they did, how they did the analysis, how they come to the results. I need to trust that. Results you write down very nicely, beautiful what you find, all the findings as objective as possible. In the analysis, you can make it your own. And in the discussion, you really can make it your own. What are your ideas? But link it up to what other people thought about it, other people think about it in a wider context. These are, I think, the general rules that apply for all international publications. And Ruud is also his editor. I've been reviewer of a lot of articles. And most mistakes I see are made in these steps. Not being clear what methods they used, not having a very nice analysis. And why this goes wrong, I don't know. But an important factor is, of course, the word count. The word count usually is around 6,000 words. And if you have qualitative research, that's a challenge. So especially at the beginning of the researcher, you have almost to, you have to make choices what to present. And that's difficult. So I wouldn't say, see, don't go for the ambition to write an article directly in 6,000 words, because that's not going to work. Take a little bit more space and then try to reduce, get out stuff you don't need. But the ambition to write it straight ahead in a scientific article won't work. And use, as a final idea, use your peers. Because otherwise, after you send in your article for publication, the editor will look at it first. So I give the word to Ruud. She is one of an editor. Then it will be sent for review to peers. So please use your own peers first, because a lot of things can get out by just reading from peers. That's it. And don't get disappointed, because it's, don't think that your first article you ever send to a journal will be reviewed. I'm not talking about accepted, huh? Be aware, reviewed directly. A lot of articles stop already with the editor. So it's a big compliment already if they take it into consideration and put it on the review. That's the first compliment, and please take it as a compliment. Then you will get feedback. Trust that wherever you will send it, no one says, oh, you're brilliant. You did such nice work. It's so good. You don't have to change anything. That simply won't happen. To whatever you will send it, they will give comments. So, but minor, major, or whatever revisions, see it as a compliment, because they see the quality is good and they have points for improvement, but see it as another compliment. Big applause for you. And then you get it published. But don't get disappointed. You won't be the first that have to send the articles 10 times, and I'm not exaggerating, to journals. So, and there again, the impact factor is taking account. Again, the higher the impact factor, the more selective they will be. But don't get disappointed, especially not with the first article. And everyone feels like if it's rejected, like, it doesn't feel nice, but that's just part of the deal. That's part of being a researcher, I think. But don't get disappointed. Ruud, would you like to add from your perspective as an editor?
Yeah, just a few things, because I think you already gave a very great overview. Yes, so I'm an associate editor for a journal. And what I notice is that so the first choice the editor makes, whether he or she is going to send it to the associate editor, is based on the abstract. And sometimes we don't, we put a lot of effort in the paper, and the abstract we just make in an hour. But please put enough emphasis in your abstract. It's not that, it sounds easy, but it's not that easy to write a good quality abstract. Yeah. So make sure, put enough effort in this, and also again, use your peers, ask feedback on your abstract specifically. So at a journal, I often feel some sort of hesitancy to ask questions, to me or to other associate editors, but we're all human beings. We all have been where you were, where you are at now, right? So if you have a question, just write an email to the editor, just approach us. There probably in your faculty, there will be a lot of people who are associate editors, who are editors, who are have experience with reviewing. Use this as a resource just to check in, right? Oh, this journal, the word limit is 6,000, but my paper is 7,000 and I cannot get it shorter. What to do, right? So if we get questions like these, it's, you know, we have answers to this, right? So don't be afraid. Ask these kind of questions to editors, associate editors. Often at conferences, at least sort of we introduced this at the International Leprosy Conference, but I know this also happens at other conferences. There is a like meet the editors session. So again, to sort of open the space, to provide opportunities to ask questions. Make use of this, I would say. And yeah, then everything you said.
That's Professor Sabedi. Do you have anything to add to this list?
I have only thing that I have to share is sometimes what happens. You submit your paper and then you check your status. And then they are trying to find the reviewers, right? And it goes 6 months, 7 months, 8 months. And after 9 months, you will get an email which will be really disappointing, right? So sometimes that is very challenging. It took time. We were waiting for, they were saying that they are trying to get reviewers. Later on, what happens? We are so sorry that we didn't get reviewer, then nothing to do with them, right? And second is, we waited for a year, but that was rejected. That also happens. So we have to be prepared ourselves. There might happen so many things, but we have to be strategic sometimes. I'll give an example that we submitted an article. This was qualitative articles, and there were so many comments related to sample size, sample power, a lot of things. And then we decided that the reviewer did not understand our article, and we decided to change our article to BMJ Open. That was published within 2 months. There are very good experiences also. So there are so many possibilities, but don't be disappointed. That is the final remarks I want to share with you. Thank you.
Thank you. That is indeed a nice adding to this discussion. I can imagine you have questions for us. I'm looking for online and I'm looking in the audience. Any questions for us relating to publication? Yeah, can you turn your name tag, then I can see at least who I'm talking to? Yeah, Shoaib Beep.
Hello, everyone. My name is Shoaib Shafkat. First of all, I would like to thank you, Ma'am Rita, for providing such a wonderful opportunity to listen you people. I would like to ask a question from Ma'am Ruth. Ma'am, you just mentioned your all paper is good, but your abstract is not good. Can you share some tips how to make the abstract of your paper more interesting, just like related to your paper? Thank you.
Yeah, so this is working. Yes, so the abstract, you only have 300 words or 500 words, right? So you need to be concise, but there should be some really essential elements should be in there. And that's, for example, the innovativeness. What is new and exciting about your study? Also the method section is important because that's where you get a feeling about the quality, right? About the quality of the work that was done. So I also sometimes think the methods, it's too short. It's not only about, I did so many interviews, but it's a bit more about the data analysis that you used. I would provide evidence that it is the foundations of the study are right and that the results are valid. Conclusion is also sometimes more difficult than we think. Sometimes it's too general. It's not connected to the findings of the study. Yeah, so there can actually be quite many issues with an abstract. Yeah, do you have anything to add?
Yeah, it's always interesting and abstract. And indeed, in line with Ruud, it's almost the same with the PhD thesis, by the way. The introduction and the conclusion with the PhD thesis is also quite difficult sometimes to write. And the abstract also comes late, but it is the most important part. But in general, you need in an abstract to have all sections. Make sure that's the gap I just told you about. Make sure you identify the niche where your research fit in. That makes it exciting. And don't think that is a huge thing. It can be very small. Maybe all research has been conducted in all areas, but not in that particular area. Or it has been done with all stuff of people, but not with that person. So it can be very small. So make your niche, but make sure that it and make it exciting. And why do people need to read this paper? That's what I want to read. And I want to read that in the introduction, but also in the abstract. This is exciting. And then I did it very carefully. So you need to write down your methodology, given an impact on the research and the conclusions. And indeed, make this again exciting. And usually abstracts only 3, max 500 words. So it's limited. But again, here as well, use your peers. Also peers that are not that close, have from a little bit different discipline, because most journals are for more disciplines. So make sure, that was the nice example Professor Sabedi just said, there is a chance that people from another discipline, yeah, sometimes it really don't fit, but it would be nice if people understand that what you do, which are not a disciplinary expert. So use peers is an important one. Yeah, and take the time to write it. Better send it one day later, but make sure you have revisit your abstract. Not quickly write your abstract. That's tricky. Take time. Yeah. Any other questions we have from the audience? Yes, Lena.
An article from someone lah, yeah. And then whether the name of the authors disclosed to you or you don't know.
Yeah, in general, the names are always hidden. Reviews are almost always, I would say not always. Depends on the journal, but in general, most cases it is closed. Doesn't mean it's not able to trace who are the authors. So it's not always that hidden because you have the reference list. So sometimes, even though there are hidden, you can still trace it. And some journals have it open. So it really depends, but they will inform you. Probably you never ask for review at this moment, but as a reviewer will be asked, and you know upfront whether it's anonymous or it is not anonymous. Do you want to add here, Ruud?
Yes, so no, there are two things: whether the reviewer knows the authors. That sometimes depends on the journal, but you will know, because if it is anonymous, you need to remove all the authors. You need to remove your own references. You need to. Your manuscript will look differently because of this. Yeah, and then on the other hand, whether the reviewer is anonymous or whether that's now a question that you get. Do you indeed, as a reviewer, it's a question: do you want to be announced to the authors or not? So often you get one yes, and you get the name, and then 2 no's. I think we often see that. Yeah.
There will be bias, right? If the reviewer and
Yeah. So there will be bias. Yeah. So I think it's an. I think all reviewers. I mean, we all do this voluntary, and we do this because we love science. We are scientists. So I think we all do our level best to be as honest as possible and to announce it when when there is a conflict of interest, right? So I do this myself, right? When I get invited and I say, okay, I'm sorry, but I'm not the right person to review this piece because I know the authors too well, but in the leprosy world, we cannot avoid, to be honest, we know so many people. I will know, there is no way I can find, So yes, sometimes I know people, but I just do my level best to be as neutral as possible. But I think it's unbiased. I'm afraid there's no such thing. I think we need to, realize that we all have our biases and we cannot, there's not a button somewhere, turn off my bias.
Yeah, because
now.
this will lead to another question of mine,
Mhm.
whether if we collaborate with well-known authors, that will be an advantage to be published.
Can you repeat the question in the microphone so we can all hear
Sorry.
also online?
This will lead to my another question is if we collaborate with a well-known scientist or well-known author that have many publication already in a peer review or a high quality international journal, whether this will be advantage for us to be for our article to be published.
Yeah, I would say the reviewers will always try to be honest. The trust again is here important. We trust the scientific community will take this seriously and not think, oh, it's that person. So, and again, most is still blind. So in most cases, you won't know the names and you have to do only as you as a reviewer might be known to the one you review. But a lot of things is just blind. So I would assume you opt for blind journals.
And it's a team effort. There will not be one reviewer, right? There will be 2, 3, 4, 5. I had in one case reviewers that look at your piece. So I think that's important to realize as well. And I know an example from our own journal where we rejected the paper of another associate editor, right? So I think it doesn't, we really sometimes do this. Yeah. So.
We're reaching the end of this program. And before I give the words to Naila again, I would like to thank you for having this 3-hour workshop with us. As I speak for myself, I enjoyed it very much. We also learned a lot from you, and I hope you learned something from us. We loved to share our experience with you, and we hope, I'm really looking forward, look at this, how much research is on this table. If you all produce a master thesis, a PhD thesis, and also online, we have now still about 80%. That's a lot of research. So that's really fun to know and to read. And I really hope you publish in nice, with your research in nice journals. And I'm looking forward that I hope you have a nice, interesting scientific career. So thank you for your attention and have enjoyed the workshop later this day.
Yeah. Thank you very much for our 3 distinguished speakers. Yeah, I believe that our discussion is very fruitful for all of you. Yeah, and also the participant. Yeah, online participant. There is 18 university join us here from Java, of course, Borneo, and then Sumatra and Sulawesi. Yeah, so I mean all of in Indonesia, and then it's already an 18 and right now participant, but we can we have 111. Yeah, so your discussions is not only for UI but also for the whole PhD students in Indonesia.
Thank you very much
you.
online.
Yeah, thank you. And I let our MC to close these sessions.
Thank you very much, Dr. Rita. And that will be the end of our first session. But before that, I would like to invite Professor Mondastri to the stage to give the token of appreciation to all of our speakers. And to all of the speakers, will you please join me here on center stage to receive the token of appreciation? Can you move forward, please? Okay, move forward. Okay, right here. Right here, please. Professor Subedi, please move forward. All right. Yep. All right. The first one is for Professor Marjoline. Will you please accept our token of appreciation? The second one for Dr. Ruth. Please accept our token of appreciation. And last but not least, for Professor Subedi. Thank you very much. And we have one more token of appreciation for all of you, from all of us. Yeah, from all of us students, the PhD students. For Professor Marjoline. For Dr. Ruth, for Professor Subedi. And for Dr. Ruth. Thank you very much. You may all be seated. Okay, we will now have a break for lunch and Friday prayer. But after the break, we will have one more very interesting session at 1 p.m. And the topic will be ChatGPT for literature review. So stay tuned and we'll hope to see you again soon. For students, we do have lunch for each and every one of you. So you can have the lunch at the back of the room. Thank you.
Sure. Very good idea.
Please don't leave just yet because we will have a photo op and photo session with all of the speakers. For all the students, please join me in the center stage right here. Please come up front and we will have a photo session with all the speakers. Yes. Okay, we'll go from here all the way to the back, facing that way, facing the window. Yep, please everyone stand right here with the professors. Yep. Okay, facing the window, facing the door. Yep, stand up. All right. Okay, please. Yep. Yep. I think yeah, behind the table. I think it is behind the table. Oke, agak terlalu jauh. Some of you, please take a seat. If there's any chairs in front of you, please take a seat so we can make room for more people. Yeah. Please take a seat, ma'am. Okay, so we can make more space for other people. Yep. All right. Okay. Yes. Wait, this one? Oh, okay, okay, okay. Yep. Thank you very much. And please have lunch. And we have prepared the lunch at the back of the room, and you may take your lunch there. We will be right here back at 1 p.m.
Aku juga kalau di luar negeri kurus karena kan makanannya bukan kayak di Indonesia ya. Banyak kan kita masak sendiri terus biasanya kita cuma biar cepat rebus-rebus aja kan. Apa kalau exercise-nya itu akan lebih banyak kan di sana kebanyakan jalan. Jadi itu juga sih yang membuat aku kurus. Which is good sih sebenarnya. Cuma kadang-kadang kita kangen. Tau nggak waktu itu kan aku lebaran-lebaran gitu ya di luar negeri pas pulang-pulang. Aku bilang sama nyokapku bikinin lagi lontongnya. Ini aja aku. Pas aku pulang, udah itu udah habis lebarannya. Kenapa udah diambilin? Oh ada. Ada yang ambil.
Is part of it finishing voor mij dan nog iets? Ik ben af. Ik lag je lucht. Ja, dacht ik. Nee, dat snap ik. Yeah, please, but yeah, it's your class, you know.